Hi, my name is Anna, and I will be going over hepatitis B virus. So, what is Hep B? It's a virus that affects the liver, can progress to liver damage or liver cancer. It's preventable by vaccine and treatable, and it can be acute or chronic. How is it transmitted? It's transmitted through body fluids and blood. It can be spread through vaginal, oral, and anal sex, direct blood-to-blood contact, vertically from mother to baby, sharing needles, unsterile tattoo piercing, barber circumcision, and healthcare practices. Hep B is not transmitted through breastfeeding. Who's at increased risk? Hemodialysis patients, infants born to infected mothers, sex partners of infected individuals, occupational exposure, men having sex with men, and IV drug use. Um, Acute hepatitis B occurs when a non-immune individual is exposed to an individual infected with hepatitis B virus. That non-immune individual will obtain an acute infection. If the infection does not clear, it will progress to chronic Hep B in 6 months. That's the point, is 6 months. It can become fibrotic and progress to cirrhosis and liver cancer. So, what are some signs and symptoms of acute hepatitis B? Children under 5 are usually asymptomatic, which is why it's really important for them to receive their vaccinations. Children over 5 are symptomatic 30 to 50% of the time. Adults under 60 are typically asymptomatic, and adults over 60 typically have more severe symptoms, which include fatigue, fever, nausea, vomiting, and arthralgia. Symptoms and signs of chronic Hep B. The age and prevalence are inversely related. So younger patients have a higher prevalence and older patients have a lower prevalence. Signs and symptoms include hepatomegaly, enlargement of the liver, splenomegaly, enlargement of the spleen, muscle wasting, palmar erythema, spider angiomas, and vasculitis. So let's go over the diagnostic serology, which can be kind of confusing. So part of the Hep B panel, which is used to screen someone for Hep B, the first is the hepatitis B surface antigen. A positive or reactive test indicates current infection with hepatitis B, but it doesn't distinguish between acute or chronic. Elevated with acute infection and declines with recovery, which I'll show in another slide. Hepatitis B surface antibody, a positive test indicates that someone is protected against the Hep B virus, either from a vaccine or if they're recovering from a past infection. These levels increase in recovery and adults will develop immunity. The Hep B core antibody is a little bit different. It indicates a person has been infected at some point in their life, but it doesn't tell you whether or not they have an infection now or if it's an infection from the past. Despite the word antibody, it doesn't provide any protection from Hep B, and this lab will remain elevated for the rest of a person's life after their infection. The IgM develops early in acute infection and declines with recovery. The HBeAg is similar indicator. It rises, it elevates during an acute infection and lowers with recovery. We also want to do liver function tests such as the AST and ALT, which are liver enzymes that, when they're elevated, they indicate some damage to the liver, which is causing the liver to release these enzymes. We can also do Hep B DNA, also known as the viral load, which is elevated during an acute infection. So, some chronic hepatitis B diagnostic tests, we can do the same thing as previously. We can do the Hep B serologies, like in the previous slide. We also want to screen for Hep C, D, and HIV as they're at higher risk. We want to do LFTs and Hep B DNA as before. But in addition, we want to do a complete blood count, an INR, an ultrasound or fibroscan of the liver. And for patients over 40, we want to do liver biopsy. So here are some graphs to kind of show you how these antibodies are going to, and antigens will increase and decrease. So for acute hepatitis B, the real diagnostic marker is that a hepatitis B surface antigen, which is the first one that's elevated and really shows that someone has an active hepatitis B infection. Um, it will also, you can also see the bar that shows like the symptoms, which occur typically between like 9 and 12 weeks. That's also when the anti-HBC or the core antigen is elevated and will persist. The IgM immunoglobulin will also increase and then decrease. And during that window between 20 and 24 weeks is usually the only indicator that we'll see is the anti-HBC. So be looking out for that. For chronic hepatitis B, we will have the HB SAG, the hepatitis B surface antigen will persist even after recovery. The diagnosis for chronic hepatitis B will be an elevated HBsAg for longer than 6 months. So for acute management of acute hepatitis B, it really only includes supportive care, and antivirals are only recommended in severe cases or when there is an increase in the PT-INR. Chronic management is a little bit more involved. Treatment is only recommended when the viral load is greater than 20,000 IUs per milliliter and after the 6-month mark, and when the liver enzymes are elevated 2 times past the upper limit of normal. We also want to teach our patient to avoid alcohol to further damage of the liver. We want to continue lab monitoring of all of those serologies. We want to encourage household members to be immunized for Hep B. We want to encourage safe sex practices such as condom use, healthy lifestyle to decrease the risk of fatty liver so they don't have that in addition to chronic hepatitis, further damaging the liver and increasing their risk for cancer. And then we also want to screen for cancer. There are some medications that we can prescribe. However, the NP will be working in conjunction with a hepatologist, but we do want to monitor for side effects such as osteopenia with nucleosides. For prevention, we really want to educate about the hepatitis B vaccine. Um, Infants should receive the vaccine at birth, the second dose at 1 to 2 months, and the third dose at 6 to 15 months. Adults who haven't received it, they have a couple of options. They can do a 3-dose series or a 2-dose series, as shown here by the Hepatitis B Foundation. Another really important thing that we want to educate about and at least know about is if a mother is positive for Hep B, then in addition to that vaccine schedule, they will also need Hep B immunoglobulin. However, if mom doesn't have Hep B, then the infant will just receive the Hep B schedule as normal. So who should be screened? The CDC recommends that all adults over 18 should at least be screened once in their lifetime using the Hep B panel, as shown before, those 3 serology tests. And anyone who asks should be tested because they might not want to, regardless of what they say or reveal upon exam, because there are some stigmatizing things they might not want to talk about. In infants, all infants who are born to hepatitis B positive moms should be serologically tested. All pregnant women in their first trimester should be screened, and patients who are at high risk should also be screened for Hep C, Hep D, and HIV. So, moms might ask, why should I vaccinate my baby? The University of Michigan has a really good um, argument for this. The younger someone is when they get hepatitis B, the worse the consequences. And like mentioned before, children under 5 are usually asymptomatic. So that's why it's important for them to get vaccinated. If infected at a young age, kids are more likely to go undiagnosed and progress to chronic infection. Some resources for patients and providers. The Hepatitis B Foundation obviously has some good resources, news updates, facts, and figures. The CDC also has patient resources, such as infographics in multiple languages explaining how Hep B is and is not transmitted. And for the nurse practitioner, the University of Washington has online lessons for providers on hepatitis B epidemiology, screening, testing, diagnosis, immunizations, and more. Thank you so much for listening to my presentation. That's done.